Joining us now to help break down what this means for the healthcare space is Toby Cosgrove, executive advisor with the Cleveland Clinic. Toby, it's always great to speak with you.
Well, it's my pleasure. Nice to talk to you. Big story.
Brent Saunders of Allergan was interviewed earlier on CNBC and was asked who should be named CEO of this new venture since they are looking, and he mentioned you. Have you been in talks with any of these parties?
Well, thank you for the flattering comment, but no, I haven't.
Would you be interested?
Well, of course, I'm always interested in talking to people about things that I will help the U.S. economy and the U.S. healthcare. Right now, U.S. healthcare is really, the rising cost of U.S. healthcare is a huge threat to the U.S. economy. And these three gentlemen, I think, who I have enormous respect for, have an opportunity to begin to have an influence on this. And it's going to require a lot of the things that they have control of. For example, the data. And we really are swimming in data. We need transparency around that data. We need fluidity of the data, and that will help bring efficiency. Right now, I think they look at a lot of the industries which supply healthcare. And hospitals are quite different from those. Hospitals right now are 20% of the hospitals in the United States are running in the red. We're working very hard to take costs out, and we've taken an enormous amount of costs out. But we need a more efficient system supporting us and a similar cost reduction and efficiency of those systems.
It sounds, Toby, like you have enormous faith or enormous hope that these three parties can get something done. Why do you think they have the power to do something that hasn't been done by all sorts of other companies and government out there?
Well, I think what they're doing is signaling the alert to the private sector of the problem with healthcare, and that we really need to do something. The private sector, I have great faith in that there's a tremendous amount that they can do to begin to reduce the cost of healthcare. For example, they have to put wellness things in place. They have to begin to understand how people go to the correct providers. They have to begin to drive the efficiency of purchasing, and that the private sector is very good at when it puts its mind to it. And I don't think we can depend totally upon government to begin to drive the cost of healthcare down. We are headed in the direction of moving to value and away from cost. But we just can't depend totally on the government to do that.
You highlighted something when you talked about the fact that you're swimming in data, and you suggested that you actually don't know how to manage it or use it efficiently enough to actually achieve better outcomes. You know, when I read this first press release, I was a little skeptical because they said they're going to focus on technology. And I wasn't convinced it's just technology that ails the healthcare sector. It's incentives. No. It's people using more than they need because there's no kind of price controls, or price controls isn't the right word, but alignment of incentives. But you do make the point, if more technology were brought to bear, what do you think if you could manage all that data? What would it do?
Well, let me just give you an example. The total amount of data and knowledge in healthcare is now doubling every 73 days. There's absolutely no way that anybody can keep track of that. So we need AI, we need new technology, we need machine learning to handle this sort of data, and we need transparency of this data, transparency to the provider, transparency to the patient, transparency to the industries that are supportive of all this. And if we have this fluidity of data, we are going to get a much more efficient system. And I think that when I think about technology, I think of that as what is going to support the reducing of costs and the improving the efficiency of healthcare delivery.
I don't know what the implication of what I'm about to say is, Dr. Cosgrove, but it seems to me that the system is so fractionalized with so many different providers and purveyors of care, basically all of whom want to make a profit one way or another. You say 20% of the hospitals are running in the red. All of those hospitals want to not be running in the red, and some want to make a profit. You got insurers, you got PBMs, you got mental health care insurers that are subcontractors to your main insurer. You got the pharma companies, you've got device makers, you've got surgery centers, you've got radiology centers, you've got recovery institutions, all working at and pricing in different ways, and there's very little systemizing of things, and it's just so fractionalized. Somehow there's got to be a way to make it more holistic.
Well, let's talk about just one segment, for example. Let's talk about hospitals. Every community had a community hospital that it supported, and they were independent. And that was in the days when there was not much you can do for somebody in a hospital and not great transportation. Now we have great transportation and very sophisticated care that we can provide in a hospital. And so, therefore, we need to have a consolidation of hospital systems across the country. You're beginning to see this, more mergers and acquisitions in hospitals each year, and that begins to reduce the cost of the back office things that support hospitals. And then ultimately you're going to see hospital systems start to come together with hospital systems that begin to reduce that. You're also you are already seeing the reduction in the number of beds in the United States, and probably you'll see a reduction in the number of hospitals in the United States, simply because we got great transportation now and we can move people to the right location for the right care at the right time.
Dr. Cosgrove, I mean, this is 3 guys can send out a vaguely worded 1-page letter and move tens of billions of dollars of market cap. I don't know if that's a testament to them or just shows how much the healthcare industry, with all due respect, or at least the insurance industry, is despised by most Americans. But here's the bottom line, doctor. Will this lower premiums? Yes or no?
I don't think we can tell at this point. I don't think we know enough about what they're planning on doing. I think it is drawing attention of the private sector to the problems that we have, and I think it's a very good thing, and I have enormous respect for these 3 individuals.
Toby, a pleasure speaking with you. Thanks for your analysis. Toby Cosgrove.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.